Thank you very much. Originally, there was another person who was the presenter, and due to some reasons, he is not available. So I am presenting the health policy, what should be and what are the problems. And I am thankful that ranking in the health of the Pakistan is somewhat less than the education. Health is 122 number ranking, and 133 is in education. As we stand at the crossroads of another year, the pulse of Pakistan's health system reveals.
I will just put it there. You continue.
Reveals a narrative that demands urgent attention. The escalating population currently at 242,946 as January 24. क्योंकि population it is not our priority. The Bangladesh when was with us, and Bangladesh has a more population, and now they have controlled their population, and we have crossed the limits. And now the fifth most populous country globally, Pakistan, has a ranking. And we have a 65% our population residing in rural areas. In the global context, Pakistan finds itself as a critical juncture with the World Health Organization ranking it 124th. Here is 124. I was seeing in the Google that was the 22, but we have decreased our more ranking 24th out of 169 countries surveyed in February 2023. The underscored the pressing need for a comprehensive examination of the state of our nation's health. The statistics are stark and disheartening. Approximately 0.5 million children under the age of 5 succumb to preventable diseases annually. At the same time, 140,000 women lost their lives due to avoidable complications related to pregnancy and childbirth. And also there's not priority our the mother and child health. We see that we have are making the more NICVDs, cardiac hospitals, not the maternity homes. And it was the great vision of the Jamshed Nasarwanji, first elected mayor. He first made the first maternity home in the name of his mother at that time in 50s, Gulbai maternity home near the Jahangir Park. And we have a need still for the more for the maternity homes, because still now we have an infant mortality rate 55 and at the birth of the 1000 from 1000, and it is more higher comparatively in our vicinity more than India and the Bangladesh. And there in India and Bangladesh is one country 20 and one country 25. We are the double. According to World Health Organization, Pakistan is facing a double burden of disease with the prevalence of hepatitis B and C with 7.6, the fifth highest tuberculosis burden in the world, and the main geography area of the malaria. And it is very bad luck that in the TB, when we see the graph in the past, we are increasing. We have a 4-5 lakh every year the new TB cases, and we have a 15,000 every year the resistant cases about the TB. So it is a very bad luck our The overall HIV prevalence is 21%. In addition, and you also remember when there was a survey in the Larkana, there was a 1200 children were find out, and the recent 2 3 years back, 2 years back, 1200 children were find out the HIV positive under the 5 years. That is very surprising also. The country has high rates of unscreened blood transfusions, drug resistant, non communicable diseases, and the injuries and the mental health now constitute the other half of the burden of disease. Injuries account for more than 11% of the total burden of disease, are likely to rise with increasing road traffic and urbanization. Still, so many times when we have a session with the traffic IG and the other, we have demanded that why not there is a compulsory helmet. And because I have seen, I was witness when I was crossing the Clifton Bridge, one young person had the accident and a death at that time he was without helmet. Disability due to blindness or other causes is also high, and services for the disabled population are limited, including the provision of assistive devices to improve the quality of life. Maternity health prevail due to preventable causes such as sepsis and hemorrhages, combined with the high neonatal mortality rates, as I discussed, in young children. Diarrhea and respiratory illness remain the major killers. The estimated prevalence of the various forms of malnutrition condition in children under the years at 31.6%, underweight 10.5%, wasting 3.3%, severe wasting 45%, stunting and 4.8%, overweight. Half of the women of reproductive age are anemic. The burden of disease is rendered worse by an increasing population. As I discussed, we have not the priority of the controlling the population. And I personally, on my interest, I last 2 years I celebrated the population day, one in the Pakistan Medical Association PMA House Karachi, and one I did celebrated in the Dawood University with the students, and my speaker was Dr. Sher Shah there in the Dawood University. But in the PMA also, I invited the advisor, the Sindh government, all the leading Green Star and the family planning organization. Still, they are not hopeful to control the population in our country. And we have in case as mentioned, we have not the proper immunization in our country still, and we are the two countries in the world, the Afghanistan and the Pakistan, who are not, both are not polio free. And 2 3 years back there was a once polio case, but the last year in 23 we found there were the 6 cases. Find out. So we have also the ischemic heart diseases, we have neonatal conditions, stroke, diarrheal diseases, diabetes mellitus. In the diabetes we are number 1 in the world now. This is a very alarming situation in Pakistan. 1 in 4 adult population is diabetic. So we are also, being an ophthalmologist, I see that in America, there's 2,000 people become blind due to diabetes every month, not every year, but 24,000. And in Pakistan, 4,000 to 5,000 people become blind every month due to diabetic blindness. And there we have not the statistics because we do not work on the statistics. Last when I celebrated with the cancer day in the JPMC, the Rufina Sumru asked, we have not the statistics about the breast cancer in Pakistan. We are not doing the registration. We have requested so many times government that we should register the cases, but still we have not the proper statistics. And 1 in 8 woman is under the risk of breast cancer in Pakistan. Kidney diseases are diabetes mellitus, tuberculosis, as I mentioned, we are very cirrhosis of the liver. These are all the diseases we are suffering. And we have the eye openers. There's the Pakistan is the 5th most populous country in the world. The current population, as I mentioned, 24 crore as of January, based on world meter elaboration of the latest United Nations data. And I mentioned that we are not controlling the population, and population is one parameter. When we will be more population, there will be unemployment, there will be illiteracy, there will be more diseases, there will be more increase of crime, and the deficiency about the water supply, food insecurity. All the problems are related with the population, and that is not our priority. 65% of Pakistan population lives in rural areas. Pakistan experiences 32% of adults between 10 to 24 years, the highest cohort in the history. 14,000 women die every year of pregnancy-related causes. The leading causes of death during the postnatal period are diarrhea and the pneumonia. In Pakistan, stillbirths vary from 36 to 70,000 or more in some rural areas. Because you are seeing that in the primary care, we are not spending money on the primary or secondary care, and our political governments always spend on money or spending on the tertiary hospitals. So there's a huge rush in the tertiary hospitals. When I was working in the JPMC, I saw there's a huge rush in eye department, ENT department. But there we are not giving the proper facilities in the primary and secondary care. There's no X-ray machine, there's no CT scan machine in the district hospitals, and we have only one burns center who's leading in the Karachi, and we have not trying to make the new burn centers, and we can formulate make in the everywhere there is a teaching hospital. When there is a medical college, there is a surgeons are available, plastic surgeons are available. That government is not priority. And when I visited last time in the burn center, I was surprised. From the Tharparkar people, the patient was admitted there. It is a very bad luck for us. Infant mortality rate, as I mentioned, there's a 55 per 1,000 live births, and children under the death rate is 68 per 1,000 live births under 5. There's a remarkable increase in the cases of cardiovascular diseases due to stress, tobacco consumption, unhealthy diets, lack of exercise, and unhealthy lifestyles. There's an increase in cases of oral and throat cancers, as you see always on the roads everywhere. We are using tobacco, we are using manaswar, we are and gutka, mawa, so many everything these causes. And I am practicing in one area. There's a balochi, there's a hookah. Still there's so much use in the families. And my mother also used the nas. There's the red color, and she always used only for 2-3 minutes. And she was also her death was from the pharynx cancer, oral cancer. And the clean drinking water is unavailable to 90% of the population. It is a big alarming situation. When I was reading in the India in the vicinity we are doing, I was surprised. Arvind Kejriwal, who is the CM of the Delhi, he has supplying the clean water free of cost to all Delhi. It was surprising for me, and within 10 years.
Can I just intervene for 1 second?
Yes.
जो ये पढ़ रहे हैं, it's been passed on to most of you. If you want to catch up on it, हमने आपको भेज दिया है.
ठीक. And diseases for the HIV/AIDS, hepatitis B and C, diabetes, kidney failure are on the rise, mostly due to imperfect lifestyle and lack of awareness. Ida, you mentioned the diabetes is one cause of the not only for the diabetic blindness but also the renal failure. Whenever you will visit the SIUT, you will find out the majority people who are going to renal failure is one cause, the diabetes. So drinking was a deficiency, as I thought, and because we are getting not purified water, the poor population who are the economically not affording to buy the privately the water, they are suffering from the more gastrointestinal diseases, hepatitis A and E, typhoid, polio, XDR, typhoid, and big problems in Pakistan, particularly in Sindh, due to antibiotic resistance is also a big problem. The polio infection remains endemic despite over 100 vaccinations round ho chuke hain. I still remember it was started by the Benazir Bhutto. First time she started to give the polio drops, but still we are not successful to control, and our polio program has deteriorated badly during the year 2019. As many as 144 cases have been reported as compared to 12 cases in the 2018. Till the end of December 23, 6 polio cases have been detected in Pakistan. Environmental diseases are on the rise because of environmental pollution. The biggest contributors are all those responsible for the cleanliness of cities, towns, and the villages, and waste management spaces. Spraying of insecticide is not done regularly, which is why we get malaria, dengue, Congo virus, and other communicable diseases. HIV/AIDS is another disaster which came to the surface very recently. It shows how the system works and how billions of international and are grabbed by the corrupt, the poorest of the poorest at the mercy of quacks and unqualified staff. Because the unqualified staff, they are also increasing the cases, and Kidwai Saab is sitting here. He was on a healthcare commission, and still we are. It is failure. Our failure is still we are not successful to control the quacks, and they are in the mid cities and mid centers. They have a so they are also the. Because the repeated syringe use and also the women are getting the when they go, वो जब ज्वेलर के पास जाती हैं कान छिदवाती हैं तो वहाँ भी तो कोई स्टरलाइजेशन का ख्याल नहीं होता. हमारे पास अभी भी जो सरकमसियन की जाती है कई साल जो गरीब इलाकों में रूरल एरियाज़ में, तो विदाउट देयर नो कंसेप्ट ऑफ स्टरलाइजेशन एंड दे आर डूइंग, तो वो जो सैलून वाले भी करते हैं और लोग भी, तो देयर शुड बी अ कंट्रोल, एंड बिकॉज ऑफ दैट वी आर सफरिंग फ्रॉम द HIV and the blood transfusion. There is not good control on the blood transfusion system, so that is also causing the not proper transfer we are getting. 55% of Pakistan comprises youth less than 30 years old. Ironically, this youth has no access to proper education and future direction. In a way, this is the reason for the rising crime rate in society. Blindness is also an issue, as 1% of the total population is suffering from blindness, which is not only preventable but curable if detectable early. تو اس میں ہم دیکھیں گے کہ بہت ساری چیزیں ہیں جن کو بہتر کیا جا سکتا ہے. میں چھوٹی ایک دو مثالیں دے دوں. وین آئی واز ورکنگ ان LRBT ہاسپیٹل ان دا 2000 آئی لیفٹ 23 سال پہلے, تو ان کا اسٹاف جنا کے جو آئی ڈپارٹمنٹ سے کم ہوگا تو وہاں 50 سرجری پر ڈے ہوتی تھی, اور جنا میں وہی اتنے اسٹاف صرف 8 سے 10 کرتا ہے, 8 to 10 surgeries per day, and there are the 50 surgeries. تو یہ ہمارا ہے کہ we are not giving the proper facility to the patient. ابھی میں جب پڑھ رہا تھا یہاں آیا کہ ویسینٹی کنٹریز کو پڑھوں, تو کیجریوال نے کیا کیا ہے کہ انہوں نے کانٹیکٹ کیا, MOU کیا ہے پرائیویٹ ہاسپیٹل سے کہ اگر دلی میں کوئی بھی جو پیشنٹ ہے اس کو گورنمنٹ ہاسپیٹل میں 3 مہینے کے بعد ڈیٹ دی جاتی ہے, وہ سرجری کوئی بھی ہو, لیپ کولی ہو, ہرنیا ہو, اپینڈکس ہو, کوئی بھی, تو ان کو انہوں نے MOU کیا ہے کہ ان کا ڈائریکٹ وہ پرائیویٹ ہاسپیٹل میں ان کو بھیجیں گے, ان کی سرجری ہو جائے گی, گورنمنٹ ول پے دا اماؤنٹ. تو یہ دیر از اے ول دیر از اے وے, انہوں نے سولوشن کیا. 24 گھنٹہ انہوں نے الیکٹریسٹی دے دی, جو ہم ابھی تک یہاں ہمارے ملک میں الیکٹریسٹی کو ہم ترس رہے ہیں, پانی کو ہم پیور واٹر کے لیے ترس رہے ہیں. تو ہم جب برابر کنٹریز کو دیکھتے ہیں, وہی بنگلہ دیش, ہاؤ دے ہیو کنٹرول دا فیملی پلاننگ, بیکاز انہوں نے 30 اپنی جو لاکھ خواتین کو جابس دے دیے, کیونکہ جو بھی وومن جب جاب میں آ جاتی ہے تو وہ بار بار پریگننٹ نہیں ہونا چاہتی, تو انہوں نے 30 لاکھ خواتین کو جابس دے دیے, تو ان کی فیملی پلاننگ کنٹرول ہو گئی. تو ہمارے ملک میں نے ابھی ریسنٹلی فیس بک پہ لکھا تھا, وی نیڈ فار کراچی ون اروند کیجریوال, کہ ہمیں بھی کوئی مل جائے, کوئی ہمارے, ہم تو دیکھیں گے آپ, ہم سرپرائز ہوتے ہیں کہ ہم جو مینیفیسٹو میں اعلان بھی کر رہے ہیں تو ہمیں یقین ہی نہیں ہوتا کہ یہ جب پہلے 20 سال سے 30 سال سے گورنمنٹ چل رہی تھی, وہی حکومت میں تھے, تو یہ عمل کیوں نہیں کر رہے تھے. ابھی عوام کو جھوٹ پہ, اور مجھے سرپرائز ہوتا ہے کہ ناٹ اے سنگل جرنلسٹ از آسکنگ دا کوسچن کہ آپ اس کو امپلیمنٹ کیسے کریں گے, جو آپ اعلان کر رہے ہیں یہ امپلیمنٹیشن کیسے ہوگی. ایک بھی جرنلسٹ نے ان سے کوئی سوال نہیں ہو رہا. مطلب کہ ہمارے جو پالیسی میکر ہیں, آپ نے دیکھا ہوگا کہ لاسٹ گورنمنٹ میں ہمیں ہیلتھ منسٹر ایک ڈاکٹر کے بغیر آدمی دیا گیا تھا, تو میں سوال کرتا تھا کیا لا منسٹر کوئی ڈاکٹر بن سکتا ہے؟ کسی ڈاکٹر کو لا منسٹر نہیں کر سکتے. دیر از اے نیڈ فار دا لا منسٹر ایز اے ون ایڈوکیٹ, تو وائی ناٹ دیر از اے نیڈ فار دا ہیلتھ منسٹر آلویز شوڈ بی اے ڈاکٹر ہو شوڈ انڈرسٹینڈ دا پرابلمس. تو ہمارے ملک میں الٹے کام کیے جاتے ہیں. تو میں سمجھتا ہوں, اور یہ بھی بڑی ایک ڈیفیشنسی ہے ہمارے ملک میں, تو کرٹیکل تھنکر بھی نہیں ہے, ایسے ادارے بھی نہیں بنے. یہ جو ہم نے آج کوشش کی ہے کنسرنڈ جو سٹیزن الائنس ہے کہ آن آور اون ایفرٹس وی آر کمنگ ہیئر اینڈ وی آر گوئنگ دیئر ٹو ڈسکس دا پالیسیز اباؤٹ دا ہیلتھ, ایجوکیشن, اکانومی. ایسے کرٹیکل تھنکر دنیا میں ہوتے ہیں, ادارے ہوتے ہیں, لیکن پاکستان میں آپ کو کرٹیکل تھنکر بھی نہیں ملیں گے. میں تو سندھ میں جتنی دیکھتا ہوں NGOs, دے آر انڈائریکٹلی بینیفیشری ٹو سندھ گورنمنٹ, تو سندھ گورنمنٹ پہ وہ کرٹیسائز ہی نہیں کرتی. ان کو ڈر ہوتا ہے کہ ہم کریں گے تو کل تو وہ اپنے نہ اجلاس میں بلائیں گے, نہ کسی کمیٹی میں رکھیں گے, تو دیر ول بی اے ٹربل. بس تھینک یو, آئی ہیو کمپلیٹڈ. Yes, I have completed. Thank you very much. I have completed my